All right, guys. We're here with Tim Rigby. So Tim's massively involved in our tendon and muscle month here at Physiologic, and he's going to tell us a little bit about ultrasounds today. So Tim, yeah, mate, can you just start by telling everyone what is an ultrasound scan and what are they used for?
So an ultrasound scan, Josh, is a musculoskeletal diagnostic imaging tool which just allows us to have a closer look at some of the body's soft tissue structures. So things like muscles, things like tendons. You can also have a look at blood vessels and neural tissue, so nerves and the way they slide and glide through tissue. So there's a few different uses for them, just depending on your injury and what you have will determine what you need it for.
Perfect. Okay, so and this behind you is what we would expect to see from an ultrasound scan?
Yeah, so these are a few different pictures of soft tissue, as I was saying. So you can have a look at, there's a quad there, there's some knee tendon stuff there, and as you look down, there's some other type ligament soft tissue injuries on there as well. So that's what they look like when you get one.
Looks mumbo jumbo to me, but anyway, we'll definitely take your word for it, mate.
It's exciting.
So when it comes to tendons, because it's our tendon month, is an ultrasound scan useful?
Yeah, I mean, look, they're very useful scans and they've got a few advantages over other scans. They can have a look at, as I was saying, tendons, so really important for the tendon pathology. So things like repetitive stress type injuries like Achilles tendinopathy, where you get the Achilles pain, and also some shoulder stuff, some rotator cuff tendinopathies. They're really useful for identifying some structural changes, so looking at how much degeneration or how much inflammation or breakdown in the tissue that may be contributing to that pain. But they're also good at looking at some tears, so whether or not you've got maybe a shoulder, like a rotator cuff tear, and it can determine whether it's full thickness or partial thickness tear. So they're really good at identifying those things. And thirdly, they're really useful for tendons to see how they're actually behaving when you move. So you can have a look at a joint and move the joint, and then you can see the tendons moving and sliding the way it should.
So real time.
Dynamic assessments.
Okay, perfect. Okay, so how would I know if I was a person that was suitable for an ultrasound? How would I know if I needed to get one?
Well, obviously, in correlation with your physiotherapist kind of guidance, you'll know whether or not an ultrasound is beneficial for you, because you have to interpret some of the findings with a bit of care. In particular, some people can get a scan, an ultrasound scan, and actually show some changes and some structural changes, which may be just a normal part of aging, and they might not have any pain or any symptoms in that tissue. So it's really important to just interpret those findings with care if you do end up having an ultrasound scan. Okay,
so you're saying that even though the scan says I have a tendon that looks a bit ragged, that doesn't actually mean I'm going to have pain?
Yeah, for sure. I mean, you could scan someone's shoulder, their rotator cuff tendon, who's never had any functional loss or any pain in their shoulder, and it might show they've got a full thickness rotator cuff tear. So it doesn't always correlate with the symptoms, so usually you have to have some symptoms and then the structural finding on the scan, and then that is a better way of looking at the ultrasound result.
Okay, yeah, because in that case we've seen people, haven't we, who've had full thickness tears but can still completely lift their arm and never had a problem in their life.
Exactly, so it's just correlating the findings with the person's symptoms is the best way to go, Josh.
Okay, cool. And so one piece of advice, or last piece of advice for anyone thinking that they need an ultrasound, or perhaps presenting to us here at Physiologic with an ultrasound.
Well, they're a great tool, and they've got, as I said, a few advantages over other diagnostic imaging techniques. But as I said, just interpret those findings that you get, or if you read the report, just interpret those findings with a bit of care, because they don't always correlate with what you're feeling and your symptoms and pain. So just be careful with that. But we can guide you and help you through those imaging techniques, and we can get you going on the right track to recovery, Josh.
Perfect. Thanks, Tim. Thanks for your time, mate. We appreciate it.
Thanks, guys.
Cheers.